quickly. So what do you do when your patient comes in and their healing abutment is off? It looks like the tissue's healed over there. This came off 3 days ago for him. But you put a little air on it and you're going to see there's a little hole in the center. See that? What you'd like to do is keep this tissue over here, and you'd like to do as little cutting as possible. So often, and rather than making an incision and having to do full anesthetic, you can just use topical, a strong liquid topical like lidocaine. Which recently some of my dental students in Puebla told me they didn't realize existed. How do you live without lidocaine? Gives you good options. So we're waiting for this tissue to heal some more. You can see how it's a little deficient there on the buccal. Put this on there for about 10 seconds. Now, if you try to put that same size healing abutment in there, you're never going to get it in there, and he's not going to appreciate that much. So we're going to use a taller, skinnier healing abutment first, a 4x7. You just try and ease it in there. Tell the patient to feel a little bit of pressure. You see that blanching? That's because it is a little bit of pressure. Go slow. Give the tissue time to adjust. I'm going to try and get my mirror in there just so you can see better. And I can feel right now it's engaging with the implant. I can feel metal on metal. But I'm going to go slowly. Alright, see the threads have bitten now? I can take my fingers off and it's staying. But you got to go slow. You got to give the tissue time to adjust. Each time I twist this, it's going to just give a little bit of pressure. Suction the back of the mouth, please. The trick is slow and patient here. You're waiting for that tissue to stop blanching. And it's always the patient's choice. Some people just don't like the needle. So as we're sitting here waiting for this to heal in there a little bit more, push that tissue back. There we go. And just finger tight. You don't have to go crazy with it, because you're going to take it back out here in a second. So at this point, let's stop and ask the patient, do you want me to numb that up with the injection, or is that okay with you?
Is it going to be like that?
It's going to be like that 2 more times.
Yeah.
Just living with this? Okay, cool.
Okay.
So, you could just leave that healing abutment in there and let the patient go. But the best thing to do is to try and get back to that original size. It just takes time. The tissue's got to adapt around there, or at least get a size higher. But for that just takes time. So what we're going to do here is we're going to give them about 5 minutes. Just go do a hygiene check, have a cup of coffee, call your bookie, whatever you guys do when you're waiting to have the patient wait. No, we don't really do that in dentistry, so I'm making that up, of course. Fortunately, he brought a little light reading with him today. So he's got his Ayn Rand book, so because he's just back from Korea. There's a good chance he's a spy, so we're looking into that too. So we're actually just buying time to hold him here until the FBI gets here to pick him up. All right. Now as we look in there, the tissue's not quite as blanching as it used to be. The patient doesn't feel any pressure. So what we're going to do is take this one out and then put the next one in. And you're going to have that loaded already for me, Shelly, so you go right straight from one to the other. Okay, so I back it out. Now we have a nice little hole in there. Just like, where'd that come from? Just from pushing the tissue back. Now we got to go in there. And you're going to push again. I know. Suction, rinse, There you go. All right. Here, take this. Okay, nice and easy. You see, it's once again blanching again because this is the next size up. And actually, I might even stop at that size because it's looking pretty good. I think the 6 was actually impeding on the tissue over here, and that might have been why it didn't seat all the way. So that's why it came loose. To counteract that, every time you do a surgery, every time you do an implant surgery, you want to have the patient back at 1 week. Actually, this is true of any kind of oral surgery, just to check, see how they're doing, make sure they're all right. And when I do that, I always go in there and I give the healing abutment just a tiny little twist like this to make sure it's all the way in. This one clearly is not all the way in yet because we're just waiting for that tissue to get better. And I like the idea of a 5 in there as I'm looking at that. You see how that tissue comes right up like that? It's already formed? Because that's what you're doing with the healing abutment. You're trying to form that soft tissue to form a nice contact there. We still have the advantage of being in orthodontics. And this is the end stage of orthodontics. You would never do it in the early stages because you don't put an implant in because there's too big of movements, then you're going to run into the implant. This is when you're just doing subtle tweaking and twisting at the end. Can you put the implant in? So those of you watching thinking, why would you ever do implants with ortho? It's end stage ortho only. It's the only time you do it. I'm now twisting this darn hard as I can, and there we go. Got a slight blanch. How is that feeling, sir?
I think it's okay.
There we go.